Hello, I'm Sophie Scott. Welcome to Health Watch. A simple dose of sunshine may be all... Yep. Hello, I'm Sophie Scott. Welcome to Health Watch. A simple dose of sunshine may be all it takes to prevent schizophrenia. 1 in every 100 people will be diagnosed with the disease. The cause of schizophrenia is still a mystery, but researchers have now discovered that getting some sun during pregnancy might be one way to prevent it. Unravelling a complex condition like schizophrenia isn't easy. It's likely to be caused by a combination of genetic and environmental factors. Now, Australian researchers think they've pinpointed one important cause.
What we have shown with this research, that if you have low levels of vitamin D, that this has a negative impact on the developing brain.
Scientists already knew that people with schizophrenia were more likely to be born in winter. To see how important sunshine or vitamin D is for brain development, they used blood samples taken through routine screening of 800 newborn babies.
We confirmed our hypothesis that particularly those with very low levels of vitamin D had about a 2-fold increased risk of going on to get schizophrenia as adults.
The findings need to be confirmed in larger trials, but researchers say it opens the possibility that pregnant women could be advised to get a daily dose of sunshine or take a vitamin D supplement in the same way they're advised to take folate to prevent spina bifida. Any future studies will need to focus on how much vitamin D is needed. But researchers say the chance to possibly prevent a serious disorder like schizophrenia through a simple public health message is within reach. 20 years ago, sufferers of post-traumatic stress disorder struggled to find relief. Now psychiatrists claim up to 90% of people with PTSD can be successfully treated.
The idea that traumatised people, especially the victims of child sexual abuse, deliberately repress horrific memories goes all the way back to the 19th century and Freud himself. But now some experts are saying the scientific evidence points the other way.
It's the opposite. They wish they couldn't think about it. The stress hormones that are released during a trauma tend to consolidate the memory, make it rather strong, and sometimes even intrusive, as you see in post-traumatic stress disorder.
In a briefing to the US Supreme Court, Professor Richard McNally described the theory of repressed memory as the most pernicious bit of folklore ever to infect psychology and psychiatry. He maintains false memories can be easily created by inept therapists, but that some abuse victims do suffer when they reassess childhood experiences much later.
And now, seeing the event through the eyes of an adult, they realize what has happened to them. And now they experience the emotional turmoil of trauma.
The good news is that now most victims can be helped.
Things have changed, happily. We actually have treatments that work.
Soldiers returning from war zones, victims of violent crime and sexual abuse, can now be helped by cognitive behaviour therapy, where they learn to assign terrible memories to the past instead of them crowding their present and future.
We're now getting at the end of between 8 and 12 sessions, 90 to 92% of people no longer meet criteria for PTSD.
Now psychologists are working to fend off post-traumatic stress in high-risk occupations by teaching recruits to develop resilience.
And finally, a study suggests that taking cholesterol-lowering drugs might reduce the risk of rheumatoid arthritis. Israeli researchers looked at more than 1 million patients. They found fewer incidents of the joint condition among those who took the cholesterol-busting drugs. That's all for Health Watch. See you next week.